Hi, Bonnie. My name is Chloe. I'm a respiratory therapist here. We're just going to talk about your newly diagnosed asthma. I'm going to go ahead and start by taking a listen to you. All right. I'm going to take a deep breath. All right, and again. Have you been taking the new maintenance medications your doctor has prescribed, your inhalers and breathing treatments as needed?
Yes.
Okay. We're just going to go ahead and talk about the symptoms that you could have with your asthma and just go over a little more in depth than your doctor has. So if you experience difficulty breathing, wheezing, shortness of breath.
Is it exercise related?
It could be. Do you feel it more when you're during exercise? Okay. Has your doctor stated that it's exercise-induced asthma?
I don't think we've decided that clearly.
Okay. So some of the symptoms you may experience are difficulty breathing, chest pain. You can have cough, wheezing, shortness of breath. You can have rapid breathing, which could increase the heart rate. Now, it can be daily, or you can experience flare-ups when you're around certain objects, or animals, people, certain scents. So if you're allergic to a cat or dog, it can be a flare-up from animal hair or smoke related. And like I said, the flare-ups can last for days, they can last for hours. With medication, they can get better. If they don't, then it's thought that you should go and seek help from your physician. With this being said, it can cause throat irritation, and then more severe attacks are less common, but they require actual medical attention, so you should go to the closest ER. And they usually typically last longer. So severe ones can cause wheezing, the cough that won't stop. You can have intense pressure, retractions. You can have difficulty taking deep breaths, difficulty talking. Your lips could go blue. Your fingernails could also turn blue. You could have a sweaty face. You could be pale. Any anxiousness, or you could start to panic. So it can escalate rapidly, and it's important to recognize these quickly. Most people think that decreased in wheezing is a good thing, but it's actually bad because no air is actually moving, and that's when you should definitely go and seek help through the ER. All right, I'm going to have my coworker Khadijah come in here and talk to you about a peak flow meter. It's just a small device that'll kind of keep your asthma under control.
Hello, my name is Khadijah from Respiratory. May I have please your name?
Bonnie.
Okay, so I have a peak flow order for you from your doctor, is that correct? So have you ever used a peak flow? Is that your first time? So this is the peak flow. Before I walk you through how to use it, I will tell you a little bit about it, okay? This is that small device. It will help you determine how well your asthma is controlled. Measuring that peak flow, your peak flow will tell you and your healthcare provider how well you can blow out air from your lungs. So knowing that is you will know if your airways are obstructed or stopped, okay? So, and the peak flow is subdivided into 3 true zones. They are the green zone, yellow zone, and red zone. The green zone will tell you that's a signal like clear. There is no symptom. So that means you are taking your medication as it is prescribed from your doctor, and your asthma is well controlled. It's 80 to 100% of your best personal number. And when we go to the yellow zone is 50 to 80% of your best personal number. It's a signal alert. It's saying that you're cheating in your medications. You're not taking your medication as it is supposed to, or like you need your controller to be increased, so you need to call your doctor to make an appointment to see them for that. And the red zone means that's a signal emergency. It's the less than 50% of your best personal number, you need to call your doctor right away to be seen or to go to the emergency room. So back to that paper that I am going to give you, you will see here, the calculation for your zones. That like the calculation will be based on your age, your gender, and your height. So after doing your calculation for you, I have these numbers. So the range of the green zone will be between that number to that number, and the yellow zone will be in between. The red zone is between these two numbers, and if you fall into these two numbers, you need to go to the emergency room. You need to be seen right away. Okay, so do you have any question for that before I go through telling you how to use the peak flow? Okay, so this is the peak flow as you see in here. That's little thing is the mouthpiece that you're gonna put here. So first of all, that little marker, you will move it down to the scale numbers by shaking it down like that. So you're gonna take a deep breath in, fill your lung all the way, hold your breath while you put in the mouthpiece in between your teeth, and close your lips around the mouthpiece. Blow, don't put your tongue against or inside the hole. Blow out as hard and fast as you can. The first burst of air is the most important, and the more you blow in will not affect your numbers because the first one is the most important. So you write the number down. If you feel like you cough in while doing that part, or you feel like you didn't do it well, don't write the number. Repeat it again, like you take a deep breath in, fill your lungs, and hold your breath. Put the mouthpiece in between your teeth, close your lips around the mouthpiece, and blow out as fast and hard as you can. Okay? So do you have anything else you wanna ask me? So do you mind repeating that in order for us to see if you understand the instruction?
Yep. Okay, so this thing's already down there, right?
Yes.
It doesn't matter like how I hold it?
It doesn't matter. It's
Okay.
gonna be that way. This
Okay.
is where you're gonna put your mouth. Like you open your mouth, you put that mouthpiece in between your teeth, and you close your lips. Don't put your tongue against the hole. Okay, let me see. That's good here. Let me see. We have 250 in between 250 to 300. So you're gonna write that number down. Repeat it again 3 times. After you have the 3 times, you're gonna add them all together and divide them by 3. Divide that number by 3. The result you have is your result, is your best number. You're gonna write that number down a note. Make sure whenever you're going to see your provider, you bring in your result. Okay? So do you have anything else?
Do I get to keep this?
Yes, that's yours.
And I need to do this daily?
Daily, you
Okay.
yes, to check your asthma. It's gonna help you to control your asthma.
Should I do it like when it's flaring up or like just at the same time every day?
Every day, it's depend on you, but you're gonna do it in order for you to know how well you're controlling your asthma, okay?
Okay.
So, thank you so much. If you need any question, you can give us a call.
Okay, well, thank you.
Thank